UNPK sebagai organisasi pelatihan klinik berusaha selalu meningkatkan mutu. Dan dalam video ini akan dijelaskan mengenai integrasi manajemen aktif skala 3 dan inisiasi dini menyusui. Adapun langkah-langkah yang perlu diperhatikan ialah pertama, perawatan bayi, yaitu keringkan, hangatkan, tanyakan keperluan resusitasi. Yang kedua, suntik oksitosin atau berikan misoprostol. Yang ketiga, potong tali pusat. Keempat, peregangan tali pusat terkendali, lahirkan plasenta dan masase uterus. Dan yang kelima, bantulah bayi untuk inisiasi dini menyusui. Hal ini akan sangat membantu meningkatkan air susu ibu yang akan berguna untuk menghindarkan kesakitan pada bayi di Indonesia. Selamat menikmati video ini.
This clinical training video demonstrates to midwives the steps in managing the third stage of labor and initiating early breastfeeding. Immediately after the delivery, assess the baby. Observe whether the baby cries strongly and is breathing without difficulty. Look at whether the baby is moving around actively or is floppy. After determining that the baby does not need resuscitation, gently dry the baby, starting from the face and head and then to the rest of the body, with the exception of the baby's hands. Do not scrub off the vernix. The baby's hands should not be dry because the odor of the amniotic fluid on them helps the baby to find his mother's nipple. Do not suction mucus from the baby's mouth or nose. Change the wet towel with a dry one. Check the uterus to ensure that there is not a second baby. Within 1 minute after the delivery, inject the mother intramuscularly with 10 IUs of oxytocin on the upper third part of her thigh. Cutting the umbilical cord should be delayed until at least 2 minutes after the delivery. Clamp the cord about 3 centimeters from the baby's abdomen. Pinch the cord with 2 fingers and push the contents of the cord towards the mother. Place the second clamp 2 centimeters away from the first clamp towards the mother. Using one hand to protect the baby, cut the cord between the 2 clamps. Tie the cord stump with a sterile thread, wrapping the thread around the cord and tying it with a square knot on the opposite side. Remove the clamps and place them in a container. Place the baby face down on his mother's chest, straightening out the baby's shoulders so that they are flat against his mother's chest. The baby's head should be between his mother's breasts, but lower than the nipples. Do not clean or wipe the mother's breasts before the baby breastfeeds. Cover the mother and her baby with a warm, dry cloth and place a hat on the baby's head. The health provider should then proceed with the active management of the third stage of labor, while the mother hugs and holds her baby. Use rolled cord traction to deliver the placenta while applying counter traction above the pubic bone. Massage the fundus of the uterus until it is contracted. The baby should be kept skin to skin on his mother's chest for at least 1 hour after birth. For the first 30 minutes, the baby will be alert and look around. He will touch, feel, and smell his surroundings. The baby will then begin to kick and move his feet, move his shoulders, hands, and body. This stimulation prompts the uterus to contract and expel the placenta. The baby will start smacking his lips, bringing his fingers to his mouth. He will then start salivating. The newborn's ability to smell is well developed at birth. The smell of the amniotic fluid on his hands will help him to locate his mother's nipples, which have a similar smell. Using his sense of smell, the baby will move towards the nipple, usually by bobbing his head, pushing his legs, and moving his shoulders and arms to position his mouth on his mother's nipple. Even with his limited vision, the baby can see the areola and will move towards it. When the baby reaches the nipple, he will raise his head and with a wide open mouth, attach to the nipple and start to suck. This first feed will generally last between 10 to 15 minutes. It is sufficient for the baby to feed from one breast. Keep the baby on his mother's chest for at least 1 hour, even if he has finished feeding. Delay all other normal newborn care until the baby has had skin-to-skin contact for at least 1 hour. Delay bathing the baby for at least 6 hours after the delivery or until the next day. Maintain the baby's warmth with a blanket and hat. Do not swaddle the baby or wrap him too tightly, as tight swaddling can make the baby colder. After an hour of skin-to-skin contact, clothe the baby and then weigh and measure him. Administer prophylactic antibiotic eye drops. Then, inject the baby intramuscularly with 1 milligram of vitamin K1 on the baby's left thigh, anterolaterally. 1 hour after, give the baby his hepatitis B immunization on his right thigh, anterolaterally. Place the baby next to his mother so she can breastfeed and easily reach him at any time. If the baby did not initiate breastfeeding within the first hour, reposition him skin to skin on his mother's chest and leave him there until he breastfeeds. In the days after delivery, keep the mother and baby close together. Encourage the mother to breastfeed as often as the baby wants to, approximately every 2 hours. Do not give any other food or fluid to the baby, including formula, as it can endanger the baby's health. Most babies do not need any fluids other than breast milk for the first 6 months of life. If you have a concern, refer the baby to a pediatrician. The benefits of skin-to-skin contact and early breastfeeding can save thousands of Indonesian babies. You should apply this new protocol to every delivery and convey this message to all pregnant women so that the next generation will achieve their optimum potential in growth and development. This film is a production of the National Clinic Training Network in collaboration with the Indonesian Pediatric Association, the Indonesian Obstetric and Gynecologist Association, the Indonesian Midwives Association, and the Indonesian Ministry of Health, with support from the Health Services Program. This film is made possible by the generous support of the American people through the United States Agency for International Development. The contents are the responsibility of JNPK and do not necessarily reflect the views of USAID or the United States government. Indonesian midwives sing this song to remember the steps in assisting a normal delivery.
Tanda gejala kala dua, orang teknis perjol pulka, siap alat, siapkan diri, naik cuci sarung oksi, pastikan pembukaan lengkap, bersih PD celup BCC. Siap ibu dan keluarga, beritahu ibu bapak, pimpinlah ibu untuk menerang. 2, 3, 1 langkah, siap-siap untuk menolong. Handuk pokok buka sarung, tolong kepala bahu badan. 3, 1, 2 langkah, penanganan bayi baru lahir. 2, 3, 2 langkah, manajemen aktif kala 3. Ini materi utama, PTT plasenta masa 3, 2, 1, darahan segera periksa. Plasenta dan robekan pasca tindakan 17. 4, hepal bersih aman.